Guess what? Health cost calculator shows most Californians would save big with Medicare for all. You're kidding. Universal healthcare campaigners in California on Monday unveiled a tool that shows how most working families would save at least $100 and likely thousands of dollars each year if each state implemented Medicare type all symptoms. The advocacy group Healthy California Now, I think they endorsed Force the Vote. I could be wrong, but I'm pretty sure there was only like one or two of these places that endorsed it. The advocacy group Healthy California, the nurses not on board with Force the Vote. Isn't that interesting? Democratic Party not on board with Force the Vote. That makes sense.
People that ran on Medicare for all.
People ran on forcing a vote on Medicare for all, not for Force the Vote. The advocacy group Healthy California Now launched a calculator that compares what individuals or families currently spend with what their costs would be under the type of Medicare for all system the Democratic Governor Gavin Newsom campaigned on a promise to enact. But he hasn't done anything. That's not happening. According to the calculator, a family earning California's median annual household income of $78,600. Now, that's not the average. That's the median. That's different. So median means half the families in California make less than that, and half the families make more than that. That's what that means, right? Median.
Oh, right.
I'm not a math surgeon. $78,600 and paying $500 in monthly health insurance premiums and $4,000 in yearly out-of-pocket costs, whose employer contributes $1,400 per month toward healthcare costs, would save nearly almost $17,000 every year. So a person making 78 grand would save $16,000 a year.
Well, look at all that great service you get for that $16,000.
And there's people who are still against Medicare for all because they don't want the government to run it.
Because it's slavery, Jimmy. That's why.
That's slavery. Again, the government wouldn't run Medicare for all. I understand what you think, but you're still going to go to your same doctor. He's just going to get a check. Instead of coming from Blue Cross or Aetna, the check's going to come from Uncle Sam. That's the only difference. An individual making $50,000 per year with a $300 monthly health insurance bill, a $500 employee pay-in, and a $1,500 in self-funded healthcare expenses would save $7,600 annually. So if you make 50 grand, you'll save around $7,000. For an uninsured person or family earning under $50,000 with less than $2,500 in out-of-pocket healthcare spending, savings would range from hundreds to around $2,000 per year. Taxpayers already foot the bill for over 70% of our state's healthcare. No shit. No show. So we're fighting over the last 30%? That's what this is? This is all about the last 30%. And by the way, our state government has a $40 billion surplus.
Wow.
That's what this is. No shit. The savings we can achieve by cutting the waste in private health insurance will allow us to guarantee improved healthcare services for all Californians while also lowering costs. Our estimates of spending under a universal healthcare system account for the added taxes required to cover the single-payer budget, while premiums and out-of-pocket costs disappear. So they're saying, no, we've already figured in that you'd have to pay more taxes for this, but even paying more taxes, you're going to save $16,000 a year.
But I'll be a slave.
You don't want to be a slave with an extra $16K in your pocket. Overall spending for single-payer will be less than under the current system, and taxes will be higher only for the very high income earners and corporations. Thus, the vast majority of working families are going to save money. Although he campaigned on it. So, yeah, he campaigned on it. He's not doing shit. Why? He's been backing away from his promise and taking hundreds of thousands of dollars in campaign contributions from private health insurance industry.
Gavin Newsom?
Shocking. That's what. So he pledged, Gavin Newsom, when he ran for governor, I'm going to do single payer in California. He gets to be governor. Never mentions it again. Never mentions it again. In January, AB Bill 1400, Assembly Bill 1400, a bill that would have implemented a single-payer healthcare system in California, was withdrawn from consideration in the state assembly in an 11th hour move that shocked and outraged progressives who had fought for the measure. Didn't shock me. It outraged me. Didn't shock me.
It was shocked.
You are not getting health care. Get it through your head.
Yeah.
While Newsom has expressed concerns over the cost of universal health care, the governor's health Meanwhile, the commission found that healthcare costs are projected to rise 30% over the next 10 years using our current system. Okay. And this is from the, isn't that great? The moment we've all been waiting for is here. We are so excited to finally launch a project that our team has been working on, our health care savings calculator. We want you to be the first to try it, share it, and tell us what you'd save. So there it is. There's the healthy calculator. So if you're against Medicare for all, why don't you go to that thing? Let's see. That's Malcolm. Remind Edward. Let's put this underneath the video. Let's put this underneath the video so people can click on it. And because every time we cover healthcare, people say, Jimmy, you hate the government. Why do you want them in control of your healthcare? Well, because the people who are first of all, they're not going to be. And second of all, the people who are in control of it now are ruthless criminal fucking capitalists. So they are in between me and my doctor. I'd rather have a G-man who doesn't have a profit motive in between me and my doctor. I don't want a guy who's got a profit motive in between me and my doctor, because that's why we can't get treatment. So I'd rather have a G-man who I can vote in or out. I can't vote for the head of Blue Cross or Blue Shield. He doesn't ask me for my vote. So those are all good reasons why you should be for Medicare for all. You would get better treatment and you would save a lot of money. That's why. Those are facts. And would we have to stay vigilant to make sure Medicare for all stayed great? Yes. But right now, the system we have is unbelievably horrible and will bankrupt you if you get sick in a serious way. Go ahead, Kurt.
I was going to say, we have this great system now that runs like a top. We don't
and the people who say that are young men and women who've never been really sick. And they don't have,
I don't get it. Yeah.
And they don't have kids who've never been really sick. And so they don't have any idea. They just think everybody's out. Wait until you get sick. Okay. I got
Glenn Beck used to talk about how awful it is when he forgot.
Remember that? When Glenn Beck, yeah.
He's like, this is terrible.
The system is so horrible. Our system. He did a video after he got out of opera, and he's like, this is horrible. Glenn Beck, a millionaire, said it was horrible. Our system now. Here we're doing live stand-up comedy coming to your town: Indianapolis, Louisville, Cincinnati, Tulsa, Oklahoma City, Detroit, Rochester. Go to jimmydorcomedy.com for a link for all the tickets for all our dates. See you in Denver, too.